I am Jennifer Maxwell, Clinical Instructor and Director of the Spanish for Healthcare Certificate Program at Catholic University of America. I would like to introduce you to the Spanish for Healthcare Certificate Program that was established in 2010 in conjunction with the Conway School of Nursing and the Department of Modern Languages and Literatures. This is a specialized program that addresses the need for healthcare providers to effectively communicate and care for Spanish-speaking populations. The program trains students with linguistic and culturally sensitive tools to improve health outcomes for Hispanic communities, and also aligns with the Conway School of Nursing's mission, which stresses ethics, values, and spirituality in healthcare. The 15-credit, 5-course certificate features language classes specific to healthcare and medicine, followed by study abroad, internship, and service learning opportunities. The 5-course certificate has 2 entry points. The first is for basic to intermediate Spanish proficiency, where students start with Spanish 107. The other is for advanced to heritage or native speakers, where students begin with Spanish 207. Over 40% of the nursing students enroll in the program, and due to the popularity, students in other majors such as psychology, biology, pre-medicine, biomedical engineering, social service, and business pursue the certificate. This is an interdisciplinary program where students have the opportunity to take a course in psychology, anthropology, or social service to complete the certificate. This multidiscipline approach allows students to apply certificate courses toward their major, minor, and language requirements. Also, honor students may also apply Spanish 208, Spanish 277, which is Cultural Competence in Healthcare, an online course, and Spanish 495B, Bilingual Health Internship, towards honors credit. The Spanish for Healthcare Certificate Program allows students to learn in the classroom and also apply their knowledge and skills in clinical and real-life settings. The program includes a 100-hour semester bilingual health internship that offers students the opportunity for direct professional experience in a public or private healthcare setting in the metropolitan DC area. Students gain a realistic perspective on how language, education, socioeconomic, and cultural factors influence health within Hispanic populations and other ethnicities in the nation's capital. For example, there are internship opportunities for hands-on clinical experience at Mary Center for Maternal and Child Health, which has 5 locations close to campus in DC and Maryland, Catholic Charity Spanish Clinic with 2 locations, one in DC and the other in Silver Spring, where students work directly with the medical director and health professionals, A Wider Circle, which is an NGO that works with migrants, homeless, and displaced individuals through health services and educational programs. There's also a paid internship with the National Hispanic Medical Association, which provides interns with hands-on healthcare policy experience on Capitol Hill that focus on supporting and advocating for health service delivery to Hispanic communities across the nation. All of these internships are metro accessible from campus. In each medical Spanish course, students are required to fulfill a 4-hour community service learning experience off campus. Catholic University is surrounded by the nation's best hospitals, medical centers, and not to mention National Institutes of Health, NGOs, embassies, and policy institutes. The certificate program has contributed significantly to CUA's emphasis on service learning and introduces students to educational experiences beyond what most universities offer. There are various healthcare study abroad opportunities. During spring break, we offer an international, intercultural clinical practicum that rotates between Costa Rica, Puerto Rico, Guatemala, or Nicaragua. During the summer, we also offer 7- and 6-week health programs in Valencia, Spain, and Santiago, Chile. Last March, 16 students, myself, and a nursing professor from Catholic spent spring break in Puerto Rico, where students applied their language and healthcare skills by working at community health fairs, serving the homeless and displaced, and caring for the elderly in remote locations that were hit hard by Hurricane Maria. Many Catholic University nursing students and alumni have come to regard this program as a necessary part of their healthcare training and value the skills they acquire in medical Spanish and cultural competence. Graduates of the program are currently employed at the National Institute of Health, Johns Hopkins Hospital, Children's Hospital of Philadelphia, New York Presbyterian Hospital, Memorial Sloan Kettering Cancer Center, Holy Cross Hospital, the Naval Medical Center, MedStar Georgetown University, and Washington Hospital Center, to name a few. Also, some have gone on to work at rural clinics in Central America, the California-Mexico border, and are traveling nurses. The success of the Spanish for Healthcare program is a direct reflection of the rapid growth of the Spanish-speaking population in the United States and the need for compassionate bilingual professionals. Spanish language training gives Catholic University graduates valuable skills that provide an edge in seeking employment and opportunities for long-term growth. Teaching these skills reflects the university's commitment to providing the best possible multicultural education and life skills for our students. If you would care for more information or have any questions, please feel free to contact me at 202-319-5256 or maxwellj@cua.edu.
I definitely wanted to go on a mission trip just because I think it's a kind of a great way to reach back out to the community while also learning for myself. And I gained a lot of Spanish experience, I gained a lot of people experience, and I think that the mission trip was something that would really highlight that and would really kind of make me a better nurse, and so that's kind of why I decided I wanted to go. I think the highlight of my trip was when we went into the mountains in Maricao and we had the opportunity to do home health visits in one of the kind of neighborhoods nearby. And with my group, we were focusing on pediatric visits. So we got to kind of go into people's homes when they invited us in, and we got to help about different children of different ages, just doing basic assessments and whatnot. But I also thought it was really great because the juniors on our trip, they'd never done a pediatric assessment. So being able to kind of do these assessments myself, but also help the juniors learn how to do it because it is different, was definitely a highlight, and being able to help out in that way.